Anesthesia plays very important role in medical coding specialties. All medical coding specialties does not need anesthesia, but 90% of medical coding specialties need anesthesia knowledge. Mostly this anesthesia knowledge is needed for surgery coders. For example, if you take inpatient coders, they need to code ICD-10 PCS. So for them, anesthesia is mandatory. If you work in denial management or surgery coding, or if you are working with CPT codes, you need to understand anesthesia well. So, in order to provide the value of anesthesia types, today we are going to learn why medical coders must understand anesthesia types. In this session, first we will learn the definition of anesthesia, then we will see types of anesthesia. My name is Harish Gupta, content creator for FastCoder 21 YouTube channel. I have nearly 10 plus years experience in all medical coding specialties. Currently working as a ambulatory surgery trainer as well as auditor. If you are visiting for the first time, please click on subscribe button to receive future updates. After watching this session, if you like this session, please click on like button in order to motivate me. So before going to understand types of anesthesia, we need to understand anesthesia. So basically, what is anesthesia? So anesthesia refers to the use of medications. Usually we will call it as anesthetics to keep you from feeling pain during procedures or surgery. These anesthetics temporarily block sensory signals from your nerves at the site of the procedure to the centers in your brain. Most of the time, patient will use anesthesia during the surgery or any type of procedure which will reduce the pain or reduce the feeling of pain during the surgery or procedure. Basically, these anesthetics temporarily block sensory signals from the site of the procedure to the centers in your brain. If you want to know more anesthesia related videos, please check in our playlist which is having CPC as well as CPT. So this playlist contains CPT contains 167 videos and CPT contains 148 videos. And also if you are looking for medical coding jobs in UAE, India and USA, please join in our WhatsApp group. This link will be in the description of this video. And if anyone looking for same day surgery coding training, please send WhatsApp message to 707-526-3939. Next, we need to understand why type of anesthesia matters for medical coders. So why means in CPT coding, we are having few codes based on anesthesia. Most of the time, local anesthesia is included in the CPT procedure. But few procedures, if you check the code description, anesthesia is also included. Few codes are having local anesthesia is included in their code description and few codes are having general anesthesia is included in their code description. So, in order to code properly, we need to check the code description as well as we need to understand what is the type of anesthesia included in the code description, as well as we need to compare anesthesia used by the physician during the procedure along with our code description. So basically CPT is very easy. In CPT coding, just we need to compare our code description along with the procedure performed by the physician. So if you are able to understand the keywords in the operative report and if you are able to correlate those keywords along with the code description, so you can code any type of chart comfortably. Hence, as we are having CPT code description based on type of anesthesia, as a medical coder, we need to understand what is local anesthesia and what is general anesthesia and why this matters to us. Next, we will see types of anesthesia. Okay, so basically these all are systemic anesthesia. So we are having first general anesthesia. So if you see this image, general anesthesia provides pain-free or it will numb whole body. Okay. So most of the time patient will use major surgeries this general anesthesia. Next one is spinal anesthesia. So most of the time below the groin this spinal anesthesia will work. Most of the time patient will use this spinal anesthesia for OBGYN procedures or any type of procedures where patient wants to perform below the groin area. Next we are having epidural anesthesia. If the patient wants to perform any type of procedure on the spinal area or if the patient wants to provide pain relief, patient will perform epidural anesthesia. Basically epidural means here patient will inject the anesthetic into epidural space which will control this blocked area. Next we are having peripheral nerve block. Usually we will call it as PNBs in the operative report. So if you see this area, it will controls or it will act on only certain area. For example, if we take the arm, so this peripheral nerve block controls or stop pain from this arm to the brain. Next we are having local anesthesia. So local anesthesia usually most of the time included in the CPT code or CPT code description or it is included in the global surgery. So you don't need to code any local anesthesia separately. So but the important thing while we code CPT procedures is this general anesthesia as well as this epidural anesthesia. Okay. So why means we are having code description based on type of anesthesia. So what is general anesthesia here? So most of the time general anesthesia usually covers or controls pain in the whole body which will induce unconsciousness as well as immobility. Most of the time patient will provide general anesthesia using inhalation or intravenous injection. And if we see epidural anesthesia, most of the time patient will use this epidural anesthesia during childbirth, surgeries and chronic pain management. So patient will perform epidural anesthesia using single shot injection or continuous infusions. Next, if we take peripheral anesthesia, most of the time this peripheral anesthesia numbs a specific nerve or group of nerves to provide pain relief. Most of the time patient will use this peripheral anesthesia for surgeries on arms, legs and face. Here also patient will administer this peripheral anesthesia using single shot injection or nerve block. And as usual, this local anesthesia most of the time will be used for small procedures or minor procedures such as biopsies, skin lesions or dental work. Most of the time patient will perform this local anesthesia using injection or topical application. Thank you friends. Thanks for visiting our channel. If anyone looking for same day surgery coding training, please send WhatsApp message to 707-526-3939. And if you like this session, please click on like button. If you are having few doubts or any type of concerns, please mention in the comment section. And if you are visiting for the first time, please click on subscribe button. If you like this session, please share it with your friends.